And we are live. Hi, good evening, everyone. Welcome to Level Up Live. We're so happy to have you. I am Sharita Gaskins Tillett. I am your host, and I want to wish you all a happy Valentine's Day, happy Love Day. As you can see, both I and my guest are in red today to celebrate the occasion. And we're just going to give a couple of minutes for folks to come in, and then I will get our guest introduced, and we'll jump right into our Love Day event. While we're waiting for other people to come in, again, I want to wish you a happy Valentine's Day. I put a post in the group earlier today about taking some time for self-love because that's actually something that we have a tendency to neglect, but it's one of our most important relationships. So, I want you to love on your family and your friends today, but I also want you to love on you. So, here we go. We're going to introduce Dr. Mary. So, Dr. Mary Leung is a physician who is board certified in internal medicine, medical oncology, and hematology. She is also a certified life coach who is passionate about serving physicians who are stressed, overwhelmed, and burned out. From the depths of her own experience, Mary started Shining with Gratitude MD, whose ardent purpose is to guide other physicians through their unique situations so they can feel better, have more time outside of their clinical work, regain control, have more clarity, and rediscover joy in life. Mary believes that if physicians can enjoy practicing medicine again, they can take better care of their patients. Through renewal, they can shine brighter for their families and all the lives they touch. Welcome, Dr. Mary.
Thank you for having me today.
Oh, I'm so happy to have you here. So let's jump right in. Tell us about you. Tell us about your journey through medicine, how you came to a place of burnout, and how you came to begin your coaching business. Let's get all the details.
All right. So I grew up in a family of physicians. Both my parents are physicians. They're retired right now. But I was just immersed in this environment that they were really passionate about their jobs and about their patients. And I thought for me, I wanted to help people. So it was just natural for me to follow their path, even though they never put the pressure on me to do uh, in the medical field. So then I just followed the very straightforward path of, you studied hard, get into college, medical school, residency, and all those things. And so then I thought to myself, well, when I became an attending, that would be great. I would be at the top of the world.
Yes, you will have
So
arrived.
yes, you have arrived. Yay. So then that day did come. I did finish fellowship, and a couple months later, I took my first job, and it's actually still my current job. And I thought, oh, great, I finally arrived. And then I joined at that time a private practice hematology oncology group that there were six of us. And 3 months after I joined, one of the senior partners retired. So my patient load quickly got filled to be full capacity, pretty much. And so I was kind of seeing more and more patients in a few months time, and I was charting slower and slower in a sense, because I was seeing more patients. So when I started at that time, that was about 13 years ago, we were still using paper charts,
Yeah.
actually. Even though in the hospital we started using the
Mhm.
electronic records. So I don't know, those of you, if you remember paper charts, the challenge was to read the handwriting, but at the
Yes.
same time, is right. But people were writing less. So there was actually less to read. I was able to kind of keep up with the charts. So came fast forward a couple years later, fully electronic medical records. And I just gradually came to the point that I was, falling behind in charting in the day. And I had young kids at that time. So I really wanted to see them so they could recognize me.
Sure.
And I really want to be part of their lives. And so even though on paper, my clinic day was supposed to end at around 4 o'clock, I was charting and doing all these clinical work outside of except for seeing patients till 7 o'clock or sometimes a little bit later. And at that point, I told myself that, oh, I really had to go home to see my kids. And so after the bedtime, a lot of times I would still be charting. And then came, late at night, time to go to bed, and the cycle started again. So it was
So
just
that sounds like a formula for burnout. I mean, it did not allow any time for your family life. It didn't allow any time for your personal life. No downtime at all. If it seems as though your life was kind of ruled by the charting.
pretty much. And I, just looking back, of course, it's kind of with a different perspective. But while I was in it, I just thought, oh, that was the normal thing to do, because it seemed like doctors around me were kind of in a similar situation. And I slowly felt stuck, and I felt like I didn't really have a choice, because I thought, if I quit, another job would be in a similar situation, unless I moved outside of, I'm in the New York area. It's pretty saturated with doctors, but I know sometimes in the rural areas or some other states, I would have a less patient load. So the patient load that I'm talking about is I was seeing about 25 to 30 patients, um, all hematology oncology patients. So I was really at the point of feeling very tired all the time. I didn't really have energy because I was sleeping, 5, 6 hours a day. And I felt exhausted physically, mentally. Um, and at times, in the weekends that I didn't have to work, I sometimes I just preferred to be at home instead of, um, being with my family or
Sure.
with friends.
So,
So,
so let me stop you there for a second, Mary. How many hours per week would you say you were spending on work?
oh boy.
168 hours in a week. So, of that 168 hours, how many would you say you were spending on work?
I mean, thinking it's probably, looking back, I would say 70 to 80 hours,
Wow.
really outside. Of course, on paper, that's not the case.
Sure.
On
So 40
paper,
hours. I'm sure your
40,
paycheck said 40 hours because they all do.
pretty much. And so that I didn't feel like that was sustainable. And so I was just operating like that for probably, yeah, a few years. And then the pandemic came.
Mm,
And of course, no one wanted the pandemic, but at that time, it really opened my eyes, because since we're, in a specialty, so we weren't really first line workers.
sure.
And so I was only seeing about a third of my patient load at that time, and we were trying to really streamline and minimize, anyone who didn't need treatment or chemo. We were trying to delay things and all. So, long story short, was I was going home on time, and meaning like 4 or 5 o'clock, and sometimes even a little bit earlier. So then I got a taste of what normal life was
Right.
like.
Yeah. You disrupted the status quo,
And
which is
I was,
often what we have to do. Yeah.
yes. So I was like, wow, I had time to think about what to do. And I had time to spend with my family, quality time. And I started to even develop my hobby of baking. so so then I thought, what if I could do that all year round, like even when I had a full load of patients again. So, during the pandemic, a lot of things happened besides the disease itself.
Sure.
For me, um, so I was actually introduced to life coaching. I had no clue what it was. I thought coaching was only for sports,
Yeah.
for athletes. And so I was introduced to life coaching, and that really transformed my life.
So how did you get introduced to life coaching? If
Yeah,
I can ask.
so yes, almost kind of fell on my lap. I wasn't exactly actively looking for it. And at that time, I was actually just randomly browsing my husband's Facebook because I didn't even have time to have my own Facebook page. And then there was this physician group about doing work outside of medicine, be entrepreneurs and, all these things. So I was like, interesting. So I was just kind of like being curious and looked into it. And so there were people, having their own companies and coaching. I was like, what's that? So then I, kind of like joined in, like, and they were talking about, something like, oh, whatever your feelings is actually affected by how you think of the situation.
Yeah.
It's not necessarily how the situation is, because you can have different perspective about
Sure.
things. So then I thought, makes sense. And then I actually joined a women physician group coaching program, which also included one-on-one coaching in the program. And there I, learned even more make sense things that we probably should all have been taught in school at some point in life.
Sure.
And then so then I was working with my coach about this whole charting situation, and because I didn't think that I could change it. I didn't think that. I thought that, well, if I had to see 25 plus patients, I will have to use this much time to chart,
Sure.
and sometimes it could even be more complicated with certain oncology patients. So then we were just working on how I was thinking about the charting, and how my thoughts were different, especially in the first half of the day versus the second half of the day.
Hmm. Okay.
Because the second half of the day, it's usually when I was falling behind.
Yes.
And yes, right. And I was getting tired, and I was telling myself that I was getting tired and I didn't really want to do this anymore. I wanted to go home. So it was kind of more of fatigue and somewhat frustrated energy. And so that was not really sustainable for me. And so because of that, my body and my mind was just kind of slowly shutting down and slowing down. So hence, falling behind on charting. And plus, I had this belief that, oh, I really had to keep my patients be on time on the appointment schedule as much as possible. So what did I do? I sacrificed my charting time. So
Yeah.
without finishing my charts, I would move on to the next patient. And I
Right. Which
think
makes it more difficult, at least in my experience, it makes it more difficult to do after the fact because now you have to sit and remember the details of what happened in a previous visit.
exactly. And sometimes just thinking back, I would be thinking about the previous patient while seeing the patient that I was
Yeah.
seeing. So I wasn't really fully paying attention to that patient. And then at the end of the day, I would be kind of mixing up little things like, who had a murmur, or, or a
Sure.
little rash or something like that, right? Like not important clinical things, but, so it's really not very helpful. So while I was working with my coach, just working on just realizing that, oh, that was what it was driving me because of how I was thinking. So then we were kind of reworking how I'm focusing on, my ultimate goal is really to go home on time so that I can spend time with my family.
Yes.
So yeah, so with that goal in mind, that it's like, so what do I have to do to achieve that? So slowly working toward that goal, and using the energy. For me, it was being focused and determined, and just remind myself throughout the day, not just first half of the day. And in terms of the strategy wise, is seeing the patient, doing the chart, and I started to allow myself that it's okay to have the next patient wait a little bit longer if I have to spend 3 to 5 minutes more just to finish that previous chart, because then I would be able to fully focus on the next patient.
Right.
And yeah.
Let me stop you. So is this still how where are you in the where are we in the pandemic at this point? Are you back to seeing a full patient load at the time that you realize that if you change your perspective on your charting and you begin to chart in a different way, that you are able to cut down some of the time?
Yes. So at that time it was probably, think, I know it seems like it's so long ago now, but
Yeah.
it was maybe about 1.5 years ago. And so I was already back to seeing 20 to 27 patients a day. So pretty full load
Yeah,
as
that's
a
yeah,
chemo person,
that's
right? And um, so at that time, working with the coach, I will in within about 3 months or so, um, because I was just keep doing it, keep doing it. So I was able to cut down my charting time, even with this load of patients, by 2 to 2.5 hours. So since then,
that's amazing. That's a gift.
it is a gift. So since then, I've been able to go home around 5 to 5:30 consistently every day. And I remember when it first happened, I thought to myself, wow, what am I going to do now? Like, in a good way.
Right. Yeah. It has to be freeing because it's almost like a form of mental bondage. If you're carrying that mental load of, I'm going home, but I know I have to get back to these charts after I put the kids to bed. It's almost like it's a distraction from your family time. And so it really, really truly is a gift to be able to leave and leave all of that, to leave the physical work and the mental work at work.
That's right. And I felt, as you said, really liberated, that, oh, I'm I'm done. And so I get to choose what to do. I get to, spend time with my family, do what I want to do, and I can do some other things too if I want to. So just kind of backtrack a little bit, is while I was working with my coach, on the whole charting situation, I because this life coaching really resonated with me so much that I joined a certification program to become a life coach myself. It was really, in the beginning, more for me to learn in depth. I think a lot of us in medicine, we just like to get to
Yes.
the bottom of things, right? Just to really learn everything thoroughly. So I was the same way, because I wasn't thinking about having a coaching business or anything like that. And then so I finished the certification in 6 months. And I also did kind of like the post certification optional work that they offered. And I really feel like a new person. So in the sense that I remember my coach would ask me in the beginning, what were your three most common emotions? And it would be something along the lines of frustration, stressed, overwhelmed, anger, things like that.
Yeah.
And
Resentment. I'm sure that was one of them.
pretty much. And so, but now my most common, emotions, I mean, there's several of them, but the three that I can think of really is gratitude, content, and joy. And I feel like, wow, I can actually enjoy medicine again, and I'm actually enjoying life. Yes, I
Right,
am
right. And
still.
and what I like about that though is that you've reclaimed your life. You know, by reclaiming your power and your power to change your circumstance, you reclaimed your life. And also what I like is that you're still in the same job. So this
Yeah,
is the job that you had all along. The job itself didn't change, but you changed. And you
yes.
were able to kind of change your reality.
Right. And I changed that by really changing how I think about my reality, and that kind of, changes my fuel of how to, get on, or get through the day. And I, believe that I have actually a lot more choices than I thought
Yeah.
that I had. And that, I just feel more fulfilling now because besides, having my full-time job, I decided to, well, since I'm able to cut down my charting time 2 to 2.5 hours a day, I have, kind of like this time that I gained. I really want to share with other physicians how I did it and how they can do it too, because I'm just an ordinary doctor. I'm not special, or, I don't have
Well,
like a
we're
super.
all special, right?
Like
Yeah.
a regular human being, we're all unique, yes, but which means that I believe that if I can do it, that means that you can do it too. Like everybody can do it, and why not? Because I think with this energy, we're we're better, equipped, and in a better mode and emotion to take care of our patients, and also we have better interaction with our family and friends, so it's a win-win situation.
Yeah, yeah. And you know that you hit on a really big point though. A lot of people, not just physicians, a lot of people feel stuck.
Mm.
And that's one of the worst feelings, to feel like you're stuck and feel like you have no options. And so, again, I love that you discovered that you actually had limitless options. And not only that, you decided not to keep it to yourself.
Yeah, and I think, about the option part, I just want to add, um, yes, sometimes, when you feel stuck and you're angry about things, about your job situation, I think a lot of times our default is to think, oh, let me quit. Let me quit this job and look for another job. And I just want to offer that before you actually think about quitting your job, just think of, I guess, make the decision in kind of in a peaceful mindset, that, just think of, is there any way that you can, change how you see the job or change how you do things. And, if you've tried those things, or if you feel like, hey, it's actually better off for me to find another job because this is really a toxic environment for me, that's okay. But I think it's important not to make it out of, being angry, or, just being in more of a neutral, emotion, to make that decision, because it's a big decision to
Yeah,
make.
yeah, absolutely. Now, I love the name, Shining with Gratitude MD. Tell me how you developed the name.
Yes. So, through coaching, because I have really made such a big change in my life, and I feel thankful all the time. And I feel that, we can always be thankful, even though, we have, good things and bad things happen to us. And that's part of being a human, right? That no matter what, like we can expect everything to be, according to our will. There's going to be something, good and something bad, and we can always find something good out of something bad too. So I'm always, thankful for what I have, and I feel like, with a, thankful heart, it's just, better to do things. And, so I feel truly thankful for really what was given to me, and what I'm going to have and what I can share. So that's why I came up with this name of Shining with Gratitude MD. I just want, besides me really, radiating out radiating out the gratitude that I have. I want to share this with others, and I hope that other physicians can do the same thing and be thankful all the time. And I feel like to be thankful, first you have to be content, to be happy with what you have. Not to say that, oh, you're going to stop there and not improve things, but just be content and just sit there, and then you can always be curious of, oh, what I can do better, and
Yes.
so I yes, so that's how I came up with the name.
Great, because it sounds like you rediscovered yourself. Because when the pandemic afforded you the opportunity to be at home and to be human, really,
Mhm.
to spend time with your family, to start baking and sleeping and doing normal kinds of things, it allowed you to get your creative juices going, and it enabled you to explore your curiosity, and it's led you here. So I applaud you for the personal development that took place in through a difficult circumstance or a challenging circumstance like a pandemic. So now tell us about your coaching business. How does it work? Do you see one-on-one clients? Do you have group coaching? What are you doing with Shining with Gratitude?
Yeah, so right now I'm offering one-on-one coaching for physicians, and who knows? Maybe in the near future I may have group coaching too. I'll let you know. But right now it's one-on-one coaching, and I really find joy in helping whoever I can help. And sometimes it's just really amazing to see the transformation of the before and after, even after a few sessions. So yeah, so that's what I do.
So you've told us about the transformation in your professional life, but I'm imagining that this has also translated to a transformation in your personal life. Can you tell us a little bit about that?
Sure. I think for me, it's kind of like how you do one thing is how you do
Yeah, yeah,
everything. And
absolutely.
so I feel like my whole outlook, my attitude has changed, and I find myself also slower to anger in general. And I view things more in a mellow way, in a sense. And I think, well, thankfully, I never really have a problem with my relationship with my husband. So that has always been good. And I feel like it's also with my two kids, like we're just, for the most part, we get along very well. And also, like, whenever I have a chance to hang out with my friends, I look forward to it. So it's kind of like the human connection that I really want to bond. And outside of seeing patients, that's also kind of the human connection that I have with
Right.
the patients. So kind of the same thing with my family, with my friends. And I just feel like even though I'm doing the same things, it just feels more fulfilling. And I think that part of transformation, um, it's it just makes me feel warm and really like shining with gratitude, radiating it out.
Well, it sounds like you're able to be more present, because I mean,
Yes.
even getting back to, you talking about the changes in the actual patient appointment, how it with the new way that you chart, you're able to give your full attention to the patient that's in front of you. And I'm
Yeah.
sure that that increases the connection. And patients can feel that. We've all been patients before. You can feel when the doctor's a little distracted or,
Mhm.
a little disconnected or distant, and I'm sure it makes a difference in that doctor patient relationship as well, as well as giving you increased fulfillment in all of your relationships. So it sounds like there was no lose in this scenario.
Yes, I mean, I would say that of course it's um as we're human beings, it's not all like 100% happy and all that. I mean, there's still challenges, like, or sometimes, for example, there's some patient or the family, maybe there's challenging clinical diagnosis and all, it's still, there's still some challenges, but right now I feel like I'm, more equipped to really figure out, okay, how to approach this. And sometimes, patients would offer up their, not just their physical symptoms, but really psychologically how they're doing. And I think that's a very important thing to address, especially in the oncology
Right.
field,
Absolutely.
because, yeah, that affects the patients and their families so much. And that's actually why I'm in oncology too, because I would like to connect with them, in this human way. And sometimes I even sneak in some coaching concepts
Yeah.
um,
Yeah.
in the visit. Even though the given visit times for me, um, it's not very long. Like each patient, I on average, follow up patients, I have about 15 minutes, and new patients maybe 45 to an hour. But sometimes, you may need a little bit longer for some complicated oncology patients. But I also, at the same time, is I feel like you don't necessarily have to spend with them 40 minutes just to show them that you care.
Right.
Sometimes it's just, as you mentioned, it's like our body language. And sometimes it's just a sentence that we say, and that show that you care, and that's all they need.
Yes. Yeah. And you're right. That's we grossly underestimate the psychological component to all illness, really.
Hmm.
So again, I think it's great that you're tapping into to that aspect of things too. So it sounds like this coaching thing for you has turned everything around and led to a huge transformation. So congratulations to you, for gaining back so much time in your life, and and then also, like I said, for sharing it with others.
Yeah, I think
So we're
sharing
almost.
is caring.
It is, absolutely, especially on Love Day, right? And
Yes.
so we're running out of time, but I always like to end on the same question, a variation on a theme. And so for you, I would ask if there was one um, best practice that you could offer to, your fellow physicians as well as others to up level their work life. What would it be?
Mm, I think is to be curious, is really, just ask yourself, if you're thinking of a certain situation, like you have this opinion, is it true? Is there any other way to think of it? Or is it helpful to think of it the way that you think? So I think be curious is kind of like a positive energy, a positive type of fuel. So to be curious is you're not really judgmental, you're not judging the situation, but be open-minded to what you're facing. So I think for me, that has really helped me a lot. That, before you come up with your own conclusions, like, I wonder if there's any other way to think of things.
Yeah, and you know what? Honestly, that's empowering because we talked about being stuck. When you feel stuck, you feel like you have no options. When you're
Yeah.
looking at a situation with curiosity and you're exploring the options, then it gives you the power back. And you
Yes.
don't feel so stuck and you feel hopeful even
Hmm.
that, if I take this path, then perhaps things can be another way.
Right.
So,
Right.
so I appreciate you for bringing that perspective to us. I appreciate you for joining us tonight. Now, before we go, I do want to let you all know that registration is still open for a weekend for me. Now, Dr. Mary, in the interview tonight, hit on something really important. She talked about how the pandemic actually caused her to be able to think about things and change her perspective. And I want you to encourage you to do the same. With a weekend for me, it actually gives you that disruption to the status quo. It gives you an opportunity to step away from your day to day life and to do the deep internal work to figure out where your life is out of balance, to figure out what your current priorities are, to figure out where you want to go, and then to build a bridge from where you are to where you're trying to go. And the best part of it is you get to do it in a community of other like minded women. So if this sounds like anything you'd be interested in, please go to www.aweekendforme.com to register. Feel free to DM me. I'm happy to answer questions. Registration is still open. It closes on the 24th. So we have about 10 days left to register. So don't forget www.aweekendforme.com. Thank you so much, Dr. Mary. Oh, Dr. Mary, tell us where we can find you.
Yes, so my website is www.shiningwithgratitudemd.com, and my email is shiningwithgratitudemd@gmail.com. I'm on Facebook, Mary Leung, and LinkedIn, Mary Leung MD.
Wonderful. Again, thank you, Dr. Mary. It's been a pleasure. You guys have a great
Thank you.
night. Don't forget to love on yourselves. Bye bye.
Bye.